Hello, my name is Dr. Ford, and I'm a licensed physical therapist who specializes in outpatient orthopedics and pediatric physical therapy. Today, I'm going to discuss to you on a condition that is very commonly seen in my scope of practice. This condition is called lateral epicondylitis, or in other terms, we call this tennis elbow. Tennis elbow is an injury that affects athletes and people who undergo repetitive motions in their normal everyday lives. The most common site of pain for tennis elbow is the side of the elbow. We call it the lateral portion, but it's right here. The elbow is a joint made up of three bones, the humerus, radius, and ulna. This joint assists with movements such as elbow flexion, so moving the palm up towards the ceiling, elbow extension, moving the hand down like so, pronation, turning the palm of the hand down towards the floor, and supination, which is turning the palm of the hand up towards the ceiling like so. This area contains many muscles that help with wrist and finger extension, like the extensor carpi radialis brevis, extensor carpi radialis longus, and the extensor digitorum. These muscles assist with various movements such as radial deviation, or moving the thumb towards the right here with your right side, wrist extension, and finger extension, like so. Typically, tennis elbow consists of inflammation of the tendons of these muscles. However, the most commonly inflamed tendon I see is the extensor carpi radialis brevis. Common signs and symptoms for tennis elbow is pain on the lateral or outer part of the elbow, right here. Repetitive wrist extension has pain, like so. And then you also have weak grip strength. Typically, the dominant arm is the most affected because it's the more exposed side because you have a lot more time with repetitive movements. This can increase the risk of an overuse injury. Tennis elbow usually has a gradual onset and doesn't just happen in a second. Pain usually develops within a week and can begin as a mild pain and then gradually worsen over time. When pain increases, muscles affected can respond by becoming inhibited, sometimes also weaken with specific movements such as wrist extension and grip strength, just as we spoke about earlier. Also, when you do stretch for wrist extension, that also causes pain in that lateral elbow area. Now, there are a few tests that you can do in order to see if you can have tennis elbow, or if you have tennis elbow now. I will go over these today with you. First, you can hold your wrist in extension and then keep your wrist in this position. So I will show you this test. All right, so you keep your hand in this position where it's in wrist extension. Use the unaffected side to go ahead and try and push down, but you don't let it move. Now what this does, it causes increased pain on this area here. Just like we were talking about earlier, it's this muscle group that you should be feeling pain if you have tennis elbow. Now, if you have increased pain there, you might have tennis elbow. This is because the wrist extensor muscle group is actually being activated. And if you already have an overused muscle, then this can actually become more irritated with movement. The second test, you can bring your wrist extensor muscle group here on stretch. So if you do a lot of wrist extension here, you can actually stretch it by doing the other way around, okay? So I'm going to show you this test. All right, so you use your unaffected side to bring your hand down. We call this passive range of motion, okay? When this happens, the muscle group can become elongated, and just like active movement, pain can increase if you have a long stretch with that muscle. Lastly, you can open your hand and then push down on your middle finger, like so. Now you might be asking, why am I only pushing on the middle finger? Well, this is actually causing resistance to the extensor digitorum muscle we talked about before. And the main action of this muscle is to cause the fingers to go up, like so. Doesn't even have to move the wrist, just moving your fingers up like so. When you push down, you can see the muscle belly here pop out. So if you have tennis elbow, then this can cause irritation around this area. If you suspect that you have any of these issues, there is a possibility that you might have tennis elbow. And later on, we will discuss various treatment options that you can take in order to treat this issue. Now, just because you tested positive on some of these tests does not mean that you have tennis elbow. These are tests that make it more likely. To determine whether you have tennis elbow, I do recommend that you seek a medical professional to make this determination. They will be able to go through various imaging techniques and go through a few more tests than you're able to do just on this video.